Hi, everybody, and welcome to the September webinar. We are with Brian Rosso, who joined our firm a couple years ago. He serves as our operations director and also one of our wealth advisors. We're so glad to have you with us, Brian.
Thank you.
Um, if you're new to us, we're a wealth advising firm in Athens, Georgia, and we were founded in 1982 by Chuck Vickery with the goal of helping people make smart decisions with their money. And we're still doing that today, and we are run by our president and CEO, Deanne Rosso, who is related but not married to you, correct, Brian?
That's correct, my brother.
That's right. So Brian joined us a couple years ago. He lives in Athens. He graduated from the Terry College of Business. He is married to Heather, and they have two beautiful boys. All are big Georgia Dogs fans, right, Brian?
That's right.
Well, thank you so much for joining us. I'll let you take it from here.
Thank you, Betsy. Let me share my screen here.
Okay.
Okay. Do you see the orange screen here on?
Yep, you are all set.
Perfect. Well, welcome everybody. Thank you for joining here today. As you know, we're going to cover a lot of basics today. We're going to cover Medicare, how it may apply to you. Planning for healthcare expenses is really a critical part in retirement. And one of the reasons because of that is it's going to be one of those biggest expenses that you're going to incur year after year. And although Medicare process may seem easy to some, on the outside, once you get down into it, look at your options. There's a lot of rules that you have to follow. Medicare process is very clear about those rules. So you want to make sure that you follow those so that you don't incur certain penalties or late fees either. So, and also you want to make sure you get the right coverage. So going through today, that's going to be kind of our focus is we want to address some of those concerns and kind of hopefully help paint a clear picture for you guys as to which options are out there, what may be most suitable for you in your specific situation as you become, Medicare eligible. So again, we're going to cover a lot of information here today. It's probably going to be about a 45-minute presentation, but if nothing else, I hope you come away with three key points here. The first key point is that if you do not enroll in Medicare on time, you will pay a monthly penalty. And a lot of baby boomers don't even know when they're supposed to enroll in Medicare. But again, there's some very clear rules here about that when you have to sign up. And if you don't sign up in your specified window, you're going to be assessed a monthly penalty, and you'll also have to pay that for the rest of your life. So we want to avoid that at all costs. The second key point here is that if you do not get the right private insurance to go along with Medicare, you may be subject to paying expensive premiums and also additional out-of-pocket costs that you're not aware of. So the fact that you're going to need some type of private insurance along with Medicare is a surprise to a lot of people. Most think that Medicare is going to cover everything healthcare related in retirement and after age 65, but that's not necessarily the case. In order to have prescription drug coverage and other out-of-pocket expenses, you'll need a policy through a private insurance. We'll kind of go through how that works here in just a moment. Lastly, the third key point that we want to cover is if you do not have a plan for a higher healthcare cost in retirement, you could run out of money and not get the care you need. So obviously do not want that to happen either. So we'll cover some basics there. Okay, so let's dive in real quick. Let's start with Medicare enrollment and go through the ins and outs of Medicare. First of all, who kind of pays for healthcare in the US today? So if you're under 65, the overwhelming majority here are employer health group insurance. So through your employer, through your spouse's employer, that represents about 55 to 60% of people covered through insurance if you're under the age of 65. Maybe you've recently left your job, you're covered under COBRA, in which you're you're footing the bill for the full expense of that. Maybe you have some type of private insurance. Maybe you have a retiree health care if you work for a state or federal government. So those are kind of your options before age 65. After age 65, uh, Medicare becomes generally your primary insurance, and Medicare pays first. So in our health insurance program, uh, once you have medical cost, typically after age 65, you're signed up through Medicare. Medicare pays what it will pay. And if you have those other private insurance on top of Medicare, they may pick up some of the additional cost. The only exception to this is if you're still employed at age 65 or after, and you're covered by a large plan that covers 20 or more employees. If that's the case, you can still stay on that plan after age 65. You don't have to sign up for Medicare at that point. Um, so that's really the one exception there, and we'll touch on that. Again, what this means for you is unless you're covered by that employer group plan or spouse's plan that covers 20 or more employees, you must enroll in Medicare when you turn age 65. So what if you don't enroll in Medicare on time? Again, the consequences here can be pretty steep. You're going to be charged typically a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be. And not only that, you're also going to have to pay that penalty for the rest of your life. Right now, penalties are about 10% per year, and that's prorated monthly. So, if you 7 months prorated, it won't be quite 10%, but so you can see that, if you delay more than a few months, it can add up. And again, it's something that you'll have to pay year after year. The second consequence of not signing up on time is that because once you turn 65, Medicare typically pays first. If you do still have some private insurance outside of Medicare by the time you turn age 65, they typically won't pay for any medical expenses covered because Medicare pays first. So they don't really know what to cover. So you can have kind of a gap in coverage there, even if you have some private insurance. And then lastly, your insurance options might be limited. So if you do have some pre-existing conditions, you're in poor health, and you missed your window to sign up, uh, if you're in your window, there is no exclusion for pre-existing conditions, so they have to allow you to sign up. But if you're adding additional private coverage on top of that, they can allow for some restrictions for pre-existing conditions outside of your normal window. So let's take a step back for a second. What exactly is Medicare? And it's our national health insurance program, and it's going to cover all people over 65 years of age. There's a few exceptions there, which we'll touch on. It was signed into law in 1965, and it's administered by the Centers for Medicare and Medicaid Services. And the enrollment is actually handled through the Social Security Administration. So who's eligible? Again, everyone over the age of 65 is eligible for Medicare. This includes all U.S. citizens, legal residents who've lived in the country for at least 5 years. And then also some people under the age of 65 can get Medicare if they receive Social Security disability benefits. For today's discussion, we're going to focus mainly on those that apply for 65. But just know that if you are on Social Security disability, that there's also a provision there that will allow you if you're under 65. So Medicare is really comprised of four main parts, and they label them with these letters. So Part A is going to be your hospital coverage. This is going to be if you're inpatient at a hospital. That is exactly what Part A covers. Part B covers parts of the cost of medical services, such as doctor's visits, some procedures, your diagnostic testing, and then also some preventative care items such as flu shots. So if you combine parts A and B, you'll typically hear people refer to that as original Medicare. On the right side of this chart here, you have parts C and D, and this is where the private insurance comes in. Part C is going to be an alternative way to get Medicare. We'll dive into that a little bit more later. That's called Medicare Advantage. You can sign up through Medicare Advantage plan through a private issuer, and it typically is going to include all the services from parts A and B, and then in a lot of cases, part D as well. So it's more of a bundled service there. Um, and then lastly, Part D is a prescription drug coverage. This is going to be offered again through private issuers who contract with Medicare. Each prescription drug plan is going to be significantly different. So it's important to really shop those plans and get what is appropriate for you. A lot of people, when they turn 65, are in good health and don't necessarily need a drug plan. So some people go into signing up with Medicare and exclude Part D because they're not really on any medications. We typically recommend to add a Part D drug coverage plan, and that's because even if you're not taking medication now, it's pretty good likelihood that you will sometime in the future. And if you delay signing up during your enrollment period, you could also pay penalties and fees along with signing up later. And you can typically get a very low cost drug plan for just a few dollars a month. So typically a good idea to sign up for a drug plan. So we've gone over the four main parts of Medicare. Now we're going to cover basically the two main options when it pertains to Medicare. On the left side, we mentioned original Medicare. That's going to be Part A and Part B. And then optional parts of that would be Part D for a drug plan. And then what they call a Medigap policy. This is a supplemental coverage, and this is going to be shown on the slide as optional, but similar to a drug plan, we would typically recommend getting some type of Medigap policy in conjunction with your original Medicare, because parts A and B of original Medicare typically leaves a lot of gaps in coverage, which we'll cover here shortly. The second way to get Medicare is through Medicare Advantage. This is going to be completely through a private insurance company. There's a lot of companies out there. I'm sure you see ads all the time for these. And I think there's close to 3,000 separate plans under the Medicare Advantage umbrella. So it becomes, if you're considering this type of plan, it takes a lot of prudent research to figure out the different types of plan in your area, what are their coverage limits, and what are their networks of doctors. Under original Medicare, you're really not limited to a network per se. Most of us on traditional healthcare before retirement or before 65 in Medicare, we typically have to see doctors that are in our network. Once you get on original Medicare, that kind of becomes irrelevant. Almost 98% of all doctors are accepted under original Medicare. So that really puts the flexibility on who you want to see and give you treatment, and it kind of puts that back on you. So you really don't have a ton of restrictions there. The downside with original Medicare is when I refer to original Medicare, just parts A and B, there's really no out-of-pocket maximums. So in a lot of cases here, we recommend the drug plan and a Medigap policy to increase your coverage on overall Medicare, on overall original Medicare. Again, Medicare Advantage plan, this insurance policy is really supposed to offer the same coverage as original Medicare, but these plans add some additional restrictions. They typically have a pretty narrow network of doctors. So getting a plan that is specific in your area is really important. The other restriction a lot of times these plans may add are prior authorizations for certain treatments or procedures. So under Medicare Advantage, you would, your doctor may recommend a procedure that typically has to go to the insurance company to get that approved. or it could potentially get denied. And if you get the procedure without the prior authorization, the cost typically ends up in your pocket, and the Medicare Advantage plan typically would not cover any of that cost. And I would look at Medicare Advantage plans as a really give and take. They're typically less cost than original Medicare plans, which is kind of the appeal, but that cost can a lot of times come at the flexibility and kind of control of your own personal care. So just keep that in mind. So how do you enroll in Medicare? So if you're actually receiving Social Security benefits when you turn age 65, your enrollment will be automatic for Parts A and B. Parts C and D are a little bit different here. They're not automatic. So if you want a Medicare Advantage plan, you'll have to contact the insurance company offering that plan and sign up through them directly. But if you are taking Social Security, Parts A and B should be automatic. So if you're not receiving Social Security benefits, how do you enroll? In this case, you'll need to proactively enroll in Medicare during a Medicare enrollment period. And there's three main enrollment periods that you need to take note of. The initial enrollment period, that's going to apply if you're not covered by a group plan that covers 20 or more employees when you turn 65. If you're covered by an employer plan or your spouse is still working, and then you would be subject to the special enrollment period. So we'll explain that a little bit deeper in a second. But if you miss either one of those periods, so you either have an initial enrollment period or a special enrollment period, depending on if you're covered by one of those larger plans. And if you miss either of those, then you would sign up in the general enrollment period. And we would prefer to avoid this kind of general enrollment period because that typically means that you missed either your initial or special enrollment period, and you have the potential to be paying a penalty or late fees if you sign up during that period. So the initial enrollment period for people who aren't covered by a group plan at 65, the window starts 3 months before the age you turn 65 and lasts 3 months after the age you turn 65. So there's a total really of 7-month window where you can sign up and don't have to pay any sort of penalty or late fees. Our recommendation is really just to get started as early as possible. There's a lot of options out there. So 3 months, 3 to 4 months before you turn 65, start doing research and start the process of signing up, because you want to be able to see what your options are out there and make sure you make the most prudent decision. If you sign up anytime before your 65th birthday, coverage will start on the first day of the month you turn 65. So for example, my birthday is August 5th. If I sign up before I turn 65, my coverage will start on August 1st of that month I turn 65. So a little bit more about the three enrollment periods, because this is important. So the initial enrollment period, again, is for everyone 65 and who is not covered by one of those large group plans of 20 or more employees. The best time to sign up here is, again, 3 months before your 65th birthday, and Medicare coverage will start on the month you turn 65. For that special enrollment period, if you are covered under a current plan, a work plan, or a spouse of a current worker under an employer group plan that covers 20 more employees, the best time to enroll here is about a month before your coverage is expected to end. That way you don't have any gaps there in coverage. And then lastly, the general enrollment period is going to be the same for everyone. This is going to run through January 1st through March 31st. And it's for people who either missed their initial or special enrollment period. So again, want to try to avoid that if we can. So how to sign up? It's actually really easy. If you go to ssa.gov, you can hit the button apply for Medicare benefits, go through a few prompts, and it's pretty easy online. If you want to call and talk to the Social Security office directly, you can call them at that number below. So that's really the two main ways to sign up for uh, Medicare Parts A and B. For Medicare Part D, the drug plan, that's a little bit different because this is offered by private insurer. You're going to have to go through the Medicare marketplace here at medicare.gov. Again, the decision between original Medicare or Medicare Advantage plan, you'll have to kind of make that determination, and then you can follow the steps to sign up. So Medicare in conjunction with private insurance. Let's touch on that a little bit. So what is the cost of Medicare? Uh, the good news is Part A is free as long as you yourself or your spouse has paid into Social Security for 10 years. Because you're paying payroll taxes, that's included in Part A. So there's no cost to you once you sign up for that. Part B has a premium. That is $174 a month per person, plus any income related adjustments if that applies to you, which we'll look at here on the next slide. And then Part D as well. This is paid to a private insurer, and these plans are going to vary very widely based on what drugs you're taking and what your need is and what do you want your coverage to be. So the initial premium cost can vary based on that, but these also do have an income adjustment applied to them if your income is over certain limits. So monthly premiums for Part D, B, and D. We mentioned there's some income related adjustments if your income is over certain thresholds. So here in this table, we have Parts B and D premiums for different levels of income. If you're single and your income is under 103,000, your MAGI, modified adjusted gross income, is under 103,000. Or if you're married and your income is under 206,000, you'll pay just that regular premium of $174 a month for Medicare Part B, and then you won't have any adjustment for Part B or D. If you are in some of those other tiers, you can see that there's additional adjustments. So if you're between 206 and 258 MAGI for a married filing jointly, you'll have to pay an additional $69.90 per person for Part B and $12.90 for Part D. And again, this is per person, so it would be double these amounts if you're joint. The other thing to know about insurance premiums and the IRMA, the income related monthly adjustment amount, is that these are going to be based on your tax return that happened from 2 years prior. So if you're looking at 2024 adjustments, they're actually taking the MAGI reported on your 2022 tax return. And a lot of times we have clients that do retire right at that age of 65. And if that's the case, there is a form you can file. And one of the qualifying events there is work stoppage. So if you were over that MAGI limit and maybe 2 years prior to retiring, but you're no longer at that income now, you can apply for relief for the IRMA adjustments. How about deductibles? So Part A deductible, again, this is going to be your hospital coverage. So each time you're admitted to the hospital, you have a $1,632 deductible per spell of illness. Part B is going to be, again, your doctor's visits, testing, and your deductible here is $240 per year. Again, can be waived for some things like flu shots and some screenings and testing. Those are considered preventative care services. And then lastly, Part D, that is $545 per year is your deductible. Along with deductibles, you'll also have co-insurance that you'll have to pay once you've hit those deductibles. For Part A, hospital, Part A pays for the first 60 days you're in the hospital. But if your stay exceeds that, you'll have to pay those additional amounts. And then for Part B, after the deductible, you have to pay 20% of Medicare approved rate. Part D coinsurance, again, you have the $545 deductible there. Then 25% of drug costs after that deductible has been paid. So again, this can vary widely. Your costs can vary widely based on which drug plan you choose, based on the medications you're taking. So it's important to pick the right drug plan for you. So after looking at a lot of those costs, you may be wondering, what exactly does Medicare coverage cover? And again, we mentioned hospital stays. The first 60 days is covered under Medicare, aside from the deductible there. Medical services, doctor visits, outpatient care, they're going to cover 80% of that approved amount, and then also some preventative care services. So still cover quite a lot there. What does Medicare not cover? This is long-term care. This can be any care outside of the US is not covered. Dental, vision care is not covered. Hearing aids, cosmetic surgery. So a lot of things to think about that will still be out of pocket that Medicare won't cover in retirement. Next, we'll touch on what Medigap is. So in conjunction with original Medicare Parts A and B, we mentioned a drug plan. There are some gaps in coverage. So a Medigap just does that. It's really designed to fill in those gaps that Medicare doesn't quite cover fully. It's going to be a private plan, but they do have to follow certain federal and state laws. And this is really designed to protect you and to make the plans easily comparable across different issuers. So Medigap insurance, they're standardized, which is really nice. They're identified by letters A through N. We'll kind of look at that here in a sec, not to confuse you with even additional letters. But it makes it nice in trying to compare different policies. If you're trying to buy a Plan G in California and a Plan G in New York, you know that they'll be comparable as far as what they'll cover. So that makes it very nice from the consumer standpoint. However, you do have to shop around for these policies because based on your area, based on the company, the premiums can vary pretty considerably, even if they are both G plans. So it's important that you don't pay too much for those. So this table is just an illustration of the various benefits for those plans A through N, those Medigap policies. The main thing to remember here is just that when you are looking for a particular plan, it will be the same for every other plan offered by other insurance companies within that letter. Next, we'll look at Medicare Advantage plans. This is also Part C of the Medicare components. They're offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the private plan is responsible for providing care to you. So what this means is you may have to use a network of doctors or hospitals, which we touched on a little bit. You'll want a plan that includes prescription drug coverage as well. And a lot of times they try to add kind of bells and whistles to these plans too, like dental coverage or vision coverage as well. But just remember, these plans are kind of structured as a give and take because they'll have to manage their costs as well. So with these Medicare Advantage plans, it's typically lower premiums than what you would see with original Medicare when you include a Medigap and a drug plan. But again, you'll just have to research these plans and see which option would work best for you, whether it's original Medicare or Medicare Advantage. So this is just another reminder, once again, to really shop for those private insurance. Medigap policies are going to be standardized, but the premiums are going to vary considerably. You want to choose a plan that, fits your needs specifically. And you want to make sure that it is a reputable company, because all G plans are going to be essentially the same. You're going to be, applying or buying a policy based on uh, maybe the response of the actual insurance company and how reputable they are and quickly they process claims. Uh, so that would be our suggestion there. Lastly, what about planning for higher healthcare costs in retirement? So here's a quick chart of how historically healthcare expenses can rise in retirement. Women tend to spend more than men on healthcare, and older people spend more than younger people. A large part of this increases are more geared towards long-term care cost, and long-term care costs are not covered under Medicare. So, what's a typical Medicare budget look like? So, these are going to be average numbers based on historical figures, but Part B premiums, if you do not have an IRMA adjustment, well, you'll pay that flat rate of 174.70. These rates are going to change based on inflation and healthcare cost over time. So historically, these do go up over time. So that's also something to consider. A Medigap policy would be roughly around $200. So the all-in cost per person would be about $414 a month. And this is just for a typical plan. So when we look at total healthcare costs uh, of our insurance premiums, that really only accounts for a small, about half of what we can expect to pay out of pocket. So we pay our insurance premiums, we add the drug plan, we add the Medigap policy if we're under original Medicare, but you will also have to pay additional expenses once you go see a doctor or if you need care. So what can cause your healthcare budget to change? There's two things here. Inflation is probably one of the biggest things. Healthcare expenses have historically grown faster than regular inflation, and we expect that to continue. And also the possibility of getting sick. As you get older, you're going to need more care, and those healthcare costs will just continue to rise naturally as you age. So there's always a possibility that your age will require more non-covered services like dental work, hearing aids, long-term care. So it's also important when you're planning about healthcare and retirement that you're including those things that Medicare doesn't cover. So lastly, we're just going to look at what are the costs of some of these day-to-day activities. It can be anything from just helping people clean the house, cook for themselves. It could be assisted living or in a nursing home. These costs increase pretty significantly and can account for a pretty large amount of expenses if you are needing that type of care for an extended period of time. So to close out here, I want to just bring up three reminders. Uh, there's a lot more we could say about long-term care planning and all the other items, but for the sake of time, I want to keep your time mindful and just talk about three quick reminders. So reminder one here is to enroll in Medicare on time. Know which enrollment period is going to apply to you, whether you need to sign up at age 65 or you can wait until your employer group coverage ends uh, and enroll then. You'll need to make sure that you enroll in time in your either initial and special enrollment period, whichever applies to you. Reminder two is to shop carefully for those private insurance plans that go along with Medicare. Evaluate all your options. Choose a drug plan, Medigap policy, or Medicare Advantage plan that's going to suit you and both in your needs and also the price point that you can afford. And then reminder 3 is just to plan for those higher healthcare costs in retirement. Again, we mentioned inflation. We mentioned just the sheer need for more cost as you age. So planning for those ahead of time can really save you a lot of headache in the long run. So thank you guys for tuning in, and I'll pitch this over to Betsy if we see if we have any questions.
Great job. Thank you so much, Brian.
Of
Really
course.
appreciate it. We did have a couple questions that came through. The first is, who do I talk to about enrolling in Medicare?
That's a good question. That can really start with someone like us. We don't sell insurance, we're a fiduciary. So the conversation about planning for those costs, whether they be Medicare related or not, planning for all of those expenses is important. Understanding what your needs are is very important. So yeah, that conversation can start with us, and we can help point you in the right direction.
Okay, great. And for those of our attendees that don't know what a fiduciary is, could you just briefly explain that since you mentioned it?
Sure. So we're a fee-only advisory firm, meaning that we don't sell products. We only get compensated from the assets that we manage directly from our clients. So we don't have um, any conflicts of interest by selling products or insurance products or annuities or any sort of those type.
Okay, thank you. Thank you. So when do I start the process of enrolling? I know you mentioned 3 months before the birthday or 3 months after, but when do you start the whole process?
Sure. I mean, your research can start, 3 to 5 months before. Obviously, you can't start the initial enrollment period until 3 months before. And again, if you're covered under an employer plan and your spouse's employer plan, and you get to delay past 65, it's still important that you sign up before that coverage ends so that you don't have that gap in coverage.
Okay. I think we've got a couple more here. Can we get a copy of the presentation? Would you mind sending out the presentation?
Of course.
Okay,
I think
wonderful.
we'll have it on the YouTube channel, right?
Yeah, it will be on the YouTube channel. But as far as the actual PowerPoint, would you be willing to share that as well?
Absolutely. What's the marketing email so we can
Yes,
share the
marketing
copy?
at elevate-wealth.com. If you want to send me an email, I'll make sure that you get that. And then we have another one. It says, this might be another session, but I would like recommendations for how to handle healthcare needs pre-65. Say I decide to retire at 62. How does one best manage healthcare needs for those 3 years?
That's a great point. Yeah, there's a lot of options out there, and we see clients that want to delay retirement till 65 just because of Medicare. But there are some really good options out there to kind of bridge that gap. If you do retire earlier than 65, we typically look at various options. I mean, one option is the ACA plans, the Affordable Care Act plans. Um, we like those because they do offer good coverage. There are income incentives, or you can get some subsidies for those types of plans. So it's important to determine, is that suitable for you, and if so, can we structure your income such a way that possibly you get some kind of government subsidy, so it brings down the cost of that type of plan. But yeah, there's several options out there that we look at for our clients.
Okay, excellent. And again, if you email marketing at elevate-wealth.com if you have further questions, or you'd like to set up a consultation with Brian or one of our advisors, we can get that going. Also, do look at YouTube and look for Elevate Wealth Advisory in Athens, Georgia. You'll see we have a whole YouTube channel and all our videos are broken out by subject. And if you click the Medicare, you'll see all month long we've been posting videos about Medicare, and then you can see past webinars we've done on it too. And this one will be there later today. And I will send a link out to anyone who registers so you can share it with any friends or family you think might benefit from this presentation. Thanks again, Brian, for all your help. We really appreciate it.
Thank you, Betsy. Thank you,
Our
everybody, for your time.